Hi, I'm Dr. Craig Escude, President of IntellectAbility. Welcome to Medical Monday. GERD. GERD's the word for today. Gastroesophageal reflux disease, GERD. We also know this as heartburn, reflux. Many of us have experienced it at some point in our lives. Studies have shown that as many as 49% of people with disabilities experience it on a regular basis. The thing is that unless a person is able to communicate the symptoms to you, symptoms like, oh, it just burns right here, or oh, I'm belching up stuff and it tastes so bad. We're not aware. We don't know how to recognize it. We don't know what we might, we don't know how to diagnose it. So it gets missed. And there are some specific behaviors that can point to gastroesophageal reflux in people with disabilities. I'm going to tell you about those in a second, but I want to tell you why it's so important. Why is gastroesophageal reflux considered one of the fatal 5+ conditions? Well, one, it's very common, but two, it can lead to other things, such as if you're refluxing, that means things are going up into the windpipe area and can be refluxed back down into the lungs, causing aspiration pneumonia. You can reflux so much that you actually have a massive aspiration episode and die immediately. More commonly, though, what you see are little bits of reflux and aspiration over longer periods of time, and it slowly causes damage to the lungs, but also this acidic reflux just going up into the esophagus, even if it doesn't make its way into the lungs, can damage the lining of the esophagus, increasing the risk of bleeding, major bleeding that can lead to death. This constant irritation of acid on the lining of the esophagus also is kind of like a constant irritation that can cause something that we call Barrett's esophagus, and that can lead to esophageal cancer. So it's important that we recognize signs of gastroesophageal reflux in people with disabilities and get appropriate treatment. If for no other reason, just because it is really uncomfortable. And do you want anyone that you care about or care for to be uncomfortable if you can treat it? I certainly wouldn't think you would. So what can we look for that might indicate reflux in people with disabilities? Have you ever had a person with a disability who doesn't communicate using words that constantly puts their hands in their mouth or constantly puts other items in their mouth? Maybe they like to chew on a sock or suck on a sock. I've seen this multiple times. They like to find things that are not food items and swallow them. We call that a Pica behavior. Well, Pica behavior is associated with undiagnosed gastroesophageal reflux. And you want, it's like, why? How could this be? Well, the thought is that when we swallow something, we're swallowing saliva that washes that acidic stuff back down into the stomach. So it's more comfortable. We know that people who have esophagitis or esophageal reflux, when they eat or drink something, it often helps. It relieves it a little bit. So that person's always looking for something to eat or drink, or they're doing something to stimulate salivation to try to wash that reflux down. They may also be reaching for the pain or reaching for the discomfort as well too, and it's down in the back of their throat. So they're reaching in there to try to soothe it, just like we do. Let's say we hit our arm on something really hard. We hold our arm and we grab that area of pain. And that may also be the reason that people have that type of behavior. Now, what about refusing meals? It's easy to say, well, this person just doesn't want to eat. They just don't want to eat. They just refuse their meals. They're not being compliant. Maybe they're refusing meals because what they have learned is every time they eat, they have terrible reflux and pain during or after that meal. So they don't want to eat anymore. So refusing meals could be a reason or an indication of gastroesophageal reflux. What about lying down? So we know if we lay down, things are more likely to pour out of the top of something, right? If you've got a bottle and you lay it down, things are going to pour out of the top. Well, imagine your stomach and your esophagus as this bottle, and you lay down, and the things move up, which might cause discomfort. So a person may not want to lie down. They may become agitated or aggressive with trying to lie down, or around meal times. They may become agitated around meal times because they're anticipating that it's going to be uncomfortable. So those are just some of the signs that you might see. Waking up in the middle of the night could also be because they're experiencing this pain because they're lying down. It may not be a night terror or just something that they do. It may be because they're experiencing pain. So as a person who supports people with disabilities, you need to be aware that all of these things could be pointing to gastroesophageal reflux disease. That's one of the things, the health risk screening tool that we have at IntellectAbility, it screens for many of these health conditions. And one of the things that it will ask questions about is, does this person wake up in the middle of the night crying? Does this person have a pica behavior? Does this person become agitated around mealtime? So it asks lots of these questions, and then it puts this information together and will provide you with information about health risks and health issues that that person might be experiencing, to help you as a supporter better recognize and understand and know what to do to treat that person. So you want to learn more about the health risk screening tool, you can look at our website, replacingrisk.com, to learn more about that. You can also learn that this in the clinical pearls, gastroesophageal reflux disease is clinical pearl number 23 from the book Clinical Pearls in IDD Healthcare. That's the Fatal 5 Plus. Look forward to having you on the next podcast, where we will discuss some other interesting and challenging medical topic in the field of healthcare for people with intellectual and developmental disabilities.